comments or questions from the public. Should a member of the public choose to be disruptive, that individual will be reminded that we are not accepting public comment. Should that individual continue to be disruptive, they will be involuntarily removed from the meeting. With that, we will start with Board of Health roll call of members and staff members. State present when your name is called. From Adams County, Mr. Richard Delaney.
Present.
Ms. Julie Mullica.
Present.
Myself, Rosanna Reyes. From Arapahoe County, Ms. Jan Brainerd.
Present.
Dr. Thomas Baywell.
Present.
Dr. Kaya Gallagher.
Present.
From Douglas County, Ms. Marcia Jarrett.
Present.
Ms. Paulette Joswick. Do we have Paulette, Renee?
Not that I could see, and I know that she just had surgery, so she may not be able to join.
I see. Thank you. Mr. Zach Nanestead.
Present.
Tri-County Leadership, Ms. Michelle Askenazi, Director of Emergency Preparedness, Response, and Communicable Disease Surveillance.
Present.
Ms. Heather Baumgardner, Director of Community Health Promotion.
Present.
Ms. Jill Bonzinski, Director of Nutrition.
Present.
Ms. Renee Brockman, Executive Assistant.
Present.
Ms. Monique Didier, Director of Administration and Finance. Is Monique with us today? Okay. Dr. John Douglas, Executive Director of Tri-County Department.
Present.
Ms. Mame Furman, Director of Human Resources.
Present.
Ms. Penny Grande, Director of Nursing.
Present.
Mr. Brian Hablasek, Director of Environmental Health.
Present.
Ms. Jennifer Ludwig, Deputy Director of Tri-County Health Department.
Present.
Dr. Kelly Wiedenbach, Director of Planning and Information Management.
She'll be joining us later.
That's fine. I'd like to take a moment to read something, particularly for those who may not be familiar with the Colorado Public Health Act of 2008, which is the law Colorado that outlines the scope of practice for public health. Public health is the utilization of science-based strategies to promote the health of the community, prevent disease, injury, and premature death, and respond to environmental threats and emergencies that could impact human health. In practice, state and local public health agencies work to ensure, and there's a host of things, the two that I'm highlighting today, are infectious diseases are monitored and investigated to prevent their spread, and hazards that cause injury or disease are mitigated. Thank you. John?
Yeah, good morning, everybody. So our main agenda item this morning is a discussion with the board about how we can enhance use of face coverings in our 3-county district jurisdiction. If I could have the first slide, please. Perfect. Okay. Back to the title slide. Yeah. Okay. Terrific. All right. So welcome everybody. Again, our primary topic for the issue that's I think if everybody knows has been in the news a lot, not just in the tri-county jurisdiction, not just in Colorado, but nationally. It is a discussion or an issue around a topic that many public health officials, myself included, think is one of the most effective prevention strategy we can use. And the question today is how do we do as good a job as possible in our jurisdiction, given the fact that we remain in a pandemic for which we do not have a cure, do not have a vaccine, and for which we are seeing resurgences in different parts of the country. Next slide, please. What I want to do today is give you a brief data summary, so we're kind of all on the same page about what's happening with data in the Tri-County region vis-a-vis COVID. Talk a little bit about the rationale for using face masks, and then talk about what I've called considerations for the Tri-County area, which is really honestly a discussion about whether or not, at least in some of our jurisdictions, a public health order mandating face mask usage as exists in a number of other jurisdictions in Colorado and nationwide would be appropriate. Next slide, please. So let's begin with now. And this is a snapshot taken from the Johns Hopkins Coronavirus Resource Center website. This has sort of rapidly become the world's go-to place to see what's happening both around the world as well as statewide. These are daily case count curves for the US and 3 states that have been severely impacted recently. And the main point to be made here is that if you look in the upper left quadrant, the US map, by the end of May, we'd like peaked the summit and we were getting down into a saddle. But as Dr. Fauci put it the other day, we never really bottomed out. We're really still ankle deep. We're really maybe getting up to our knees in the first wave. So nationally down, and then we've seen a big uptick. And so the memories of New York City back in late March, early April have not yet been equaled in Texas and Florida, but those hospitals are getting full now. And as the other 3 histograms show, those counties states not long after a Memorial Day, correction, that's Texas, California and Arizona, I don't have Florida here, really quickly began to rise up. That was particularly so in Texas, Arizona, but even California, which is, had a fairly aggressive action by the governor in lots of ways, began, particularly in Southern California, particularly as the weather got nice and frankly got hot, and people began to enjoy the outdoors, but also began to congregate indoors in places which, unlike Colorado, it's not quite as comfortable to gather outdoors. It's either humid like Texas, or it's really hot and dry, and being outdoors is not quite as user friendly. Next slide, please. This is a snapshot that doesn't project very well. I apologize about that. I wasn't quite sure what the format was going to be here, but basically we've now got the majority of states in the US, 36 states as of July 6th, that have got rising rates. And these are ordered by the current incidence levels. And we begin with the states that I've mentioned at the top. Colorado is circled in red and it's down near the bottom. And we do have rising rates, even though we remain quite low thus far in terms of what's been happening. And as you've undoubtedly heard, governors in a number of states, as well as mayors of large cities, as they've begun to respond to the outbreak, which has been characterized in many places by mostly young people, lots of ostensibly partying, or lots of social congregation without attention to social distancing or masking, have been looking for ways of trying to mitigate the epidemic. As already mentioned, some of these jurisdictions are beginning to experience what we desperately tried and really did avoid in Colorado in late March and early April, which is an overwhelming of our medical care system. And governors in those places and mayors in those places are really beginning to see it, which is why in many locations, the discussion of increased use of face masks through mandates is becoming more and more common. Next slide, please. So this is Colorado data. This is data from yesterday. This is State Health Department websites and a daily case count. This is actually looking at it as a rolling 3-day average. And I think the main point here is not necessarily any particular day, but the general shape of the curve. And we don't look quite like that US curve. We had a peak, we had a saddle, but we are starting to climb. And again, as you can see, while there's some sawtoothing, and frankly, some of that sawtoothing is based on when people go in and get tested. And even more importantly, whether test results get delayed. That's one thing I want to point out, that we are beginning to see delays in test results. This is almost certainly part of the national situation, which, as Texas, California, Florida, Arizona are doing more testing. Some of the labs that serve us are national labs, and their turnaround times have gotten delayed from 1 to 2 days up to, in some cases, 7, 8, 9 days, which is really a difficult framework to either for an individual or to try to manage an epidemic from a public health perspective. Next slide, please. Now, we're drilling down even further, and this is case data from the Tri-County region. And this, like the state data, is a rolling 3-day average. And I think most of my slides are going to be using the same color coding, with Adams in orange, Arapahoe in red, and Douglas in turquoise, greenish. And the big theme here is that Arapahoe, as you see at the top, has historically, since the beginning of the epidemic, had the most cases, over 5,500. Adams just under 4,500 a second, and Douglas has had far and away the fewest cases, just over 1,100 at this point in time. What you can begin to make out here, and I'll show you some clearer ways of seeing this, is that Adams, more orange, more recently, is beginning to overtake, and in fact has overtaken Arapahoe and certainly Douglas as our county that's got the most number of cases. The other thing I'd want you to note here is that even for Douglas County, where the numbers do remain quite small, the trend has been upwards. So we are seeing in our 3 counties, somewhat differentially, but nonetheless similar to what we saw statewide and similar to what's been seen nationally, a beginning to see an uptick. Now, some of this is almost certainly due to increased testing, and there's been a robust national debate as to whether or not it's just the testing or whether or not there's actually increased transmission going on. And we think that probably in Colorado, both are happening. We think that early June, it was probably more testing because we were clearly able to expand our testing capacity. We think more recently, it's beginning to reflect more transmission. Next slide, please. Now, as most people have noted, most people with COVID don't get all that sick, but about 20% overall, and maybe about 15% in Colorado, do get sick enough to be hospitalized. And this is a similar trend curve looking at what's happening with hospitalizations. And the point I would make here is that, number one, like cases, Arapahoe had the highest number in aggregate since the beginning of the epidemic. Those are the bars across the top of the screen that, again, I'm sorry, they are hard to read, but at least you can squint and see the trends. The daily hospitalizations at the bottom, however, tell a slightly different story than our case curves. We do not see yet, and I say yet, the uptick in hospitalizations, which is good. Now, there is a little bit of an uptick, and I think we have to be careful about that. But at least at this point, we're nowhere near the situation that some of our neighbors to the south have seen, where hospitals are getting more and more full. Next slide, please. And then finally, because of course, death is the ultimate outcome that's a bad outcome with COVID, I just wanted to show you what the death trends are. And once again, at the top, Arapahoe, predominantly because of big outbreaks in nursing facilities, long-term care facilities, has had far and away more deaths than our other 2 counties have. The deaths have trickled down, and the deaths have been flat lately. And that's really good news, of course, because if you get sick, even if you get hospitalized, but you don't die, that's a better outcome than actually dying. I would note that death statistics do lag, so we have to be somewhat cautious about interpreting that tail. But it does look like that, at least at this point in time, we're not seeing, similar to hospitalizations, an increase in death rate, which I think is, again, quite encouraging. Next slide, please. Now, we're going to look at those same case numbers in a slightly different way. And these are looking at incidence rates. And an incidence rate is looking at new cases divided by the population. And in this case, we're using a denominator of 100,000 population. I want you to note that these are currently defined on this particular graph as weekly incidence rates. So it's the number of cases in a week divided by the number of people living in that county. You're going to see a similar trend curve, but you're going to see a couple of differences here. First of all, you're going to see more clearly now what happened temporally for each county. Douglas sort of reached its nadir, green line at the bottom, in late May, and then has gradually been climbing since then. Again, I think highly compatible with increased testing, but we have to be careful that increased transmission isn't part of it as well. You see that Arapahoe, Arapahoe and Red, after that big surge in particularly late April, has climbed down and is now has climbed down much faster and has got rates closer to Douglas, even though those rates are now beginning to climb as well. And then finally, orange at the top, as alluded to before, Adams County saw the same nadir, if you will, the sort of valley being the first week of June. And now we've seen that climb up again. It's not an even steady climb, it's a stair-step climb. But what we're left with is an incidence assessment for Adams County now being our county with the highest incidence rate, followed by Arapahoe and followed by Douglas. Next slide, please. We're going to talk about Aurora today, so I want to show you some Aurora data. We don't have things analyzed quite as detailed at the city level as we do at the county level, but this is a case curve, daily cases in Aurora. And again, sort of similar pattern. You've got that one weird spike at the end of May. I think that was some delayed testing coming in, or it might have been the opening of the Pepsi Center. I'm not quite sure what. But overall, you see things going down until about early June and then beginning to come up a little bit. Now, not coming up quite as much as we see in Arapahoe and Adams. And this is not a rolling 3-day average. These are just daily. So it's a little harder from an eyeball perspective. But I think the message is basically we're nowhere near where we were, but things are beginning to slide up a little bit. What you see across the bottom is maybe more important to focus on. I showed you those incidence curves for our 3 counties and showed you where Adams, Arapahoe, and Douglas stand. That 39.37 is the weekly incidence rate per 100,000 for Aurora during the first week of July. And the key point here is that that's a relatively high number, and that number is actually fairly close to what one is seeing in Adams County. Next slide, please. Finally, and again, I'm distressed as to how hard these things are to read. So it's good that it's got colors. This is looking at daily incidence rates. So it's still rates adjusted for population. But I got this from Denver, and they're measuring incidence at the daily level, not the weekly level. Green is Denver. That's the highest right now. Blue is Adams County. Orange is Arapahoe County. Red is Boulder County. You see that blip about 3 weeks ago, 2.5 weeks ago, when Boulder had an outbreak related to students first going to protest in Boulder, but probably more importantly, going to graduation parties indoors. That went up, it went down. But as you see, Denver is right now in first place in the metro area for cases. Adams County is quite close. And Arapahoe County is somewhat clustered in third place, but somewhat clustered down from a daily incidence point of view with the other counties in the metro area. Next slide, please. Now, this is maybe the most important set of numbers to look at for a couple of reasons. First of all, you can read them, which is good. But secondly, I want to talk a little bit about 2-week incidence rates, because I'm going to talk to you about the fact that the state is going to be defining various opening capacity measures. Can businesses open up? How much can they open up? How easy it is for a business to get into the newest category of public health orders, something called Protect Our Neighbor. And one of the major parameters for that is your 2-week incidence rate. And the state defines a 2-week incidence rate that's considered low to be a rate below 25 per 100,000. And a 2-week incident rate that's deemed to be intermediate or medium as 25 to 50 per 100,000. And a rate that's deemed to be high as above 50 per 100,000. So if you sort of scroll or scan across the eyeballs across the middle, you know, Adams is over the past 14 days got an incidence of 92 per 100,000. So that's very near the high range. It's quite high. Arapahoe's sort of in the middle, 58 per 100,000. That's actually still determined to be high. whereas Douglas is lower than that, but not that much lower, 43 per 100,000. I'm also showing you a slight tweak across the bottom row here, and that's adjusting the incidence rates over a 2-week period of time, subtracting out outbreaks that are occurring in long-term care facilities and correctional facilities. The state has said, let's look at it 2 ways. Let's look at the general community, and then let's look at those congregate settings where we know things can blow up fast, so we can sort of get a picture as to what's happening in the general community. And now you see that the rates in Adams is still in the high zone, 63. Arapahoe is still in the medium zone of 39, and Douglas is also in the medium zone, 29, with again that low cut point being below 25 per 100,000. Next slide, please. Now, you can't read this. It was even hard for me to read it, and now it's impossible. But what I'll talk you through it is that this is the state's definition of incidence thresholds, and it's more or less what I've already told you with 1 or 2 tweaks. Low is less than 25. That's green on the left slide. Orange is 25 to 50. That's medium. And high in darker orange is greater than 50. That's if a county has a variance. And right now, all 3 of our counties have variances from public health orders. That means that whatever the base case that the state sets, a county is allowed to do something different. They can open a business that they otherwise couldn't open. They can have more people in the business than they otherwise could have. So a variance buys you more room, and the state now sort of set up an elevator category. If you get a variance for indoor malls, for example, and you have a low incidence rate, your capacity can be greater. At this point, indoors, you can have up to 175 people, and outdoors up to 250 people. If your county's incidence goes above 25, your capacity drops. Indoors to 100, outdoors to 175. That's a reduction of 75 in each of those categories. And then finally, if you get even higher, then your incidence drops further by another 50. Indoors down to 50, outdoors down to 125. Now, there is a footnote on these things, and the footnote is if your testing positivity rate, and I mentioned testing positivity earlier, remains low, then you can be deemed to be in a category even if your incidence rate is higher. So if your testing positivity rate is under 5%, and I'm going to show you that 2 of our 3 counties, that's true right now, you can be low regardless of your incidence. If it's under 10%, you can be medium regardless of your incidence. And if it's below 15%, or actually testing doesn't really matter at the high level. The right side of the slide looks at qualifications for moving it to protect our neighbor. And I don't want to go into too much excruciating detail about this because we're still learning about it. The governor announced it last Tuesday, but basically it's a new category. And the simple bottom line is that if a county gets into the protect our neighbor category, then rather than going through the state variance process, which I think all 3 of our county commissioners would tell us has been frustrating at the least, those counties get to work directly with the health department on increasing capacity. So it's sort of saying, hey, you guys are in pretty good shape. And because you're in good shape, you don't have to go through the state process. You can work with us. Now, honestly, I don't know if this is going to be, like the gold ring, going to be fantastic, or if it's going to be not so fantastic. It looks pretty good on paper. We haven't tested it out yet. But what I wanted to emphasize is that we've got those same incidence thresholds. That's the whole reason for going into all this right now. You've either got to be below 25 per 100,000 population incidence-wise, or you've got to have a testing positivity rate of less than 5% and an incidence of less than 50%. Now let's go to the next slide, and I'll try to explain what all this means for our counties right now. Next slide, please. Yeah, okay, so testing positivity, once again, hard up. Back to the previous slide. Yeah, there we go. So across the bottom are test positivity rates for orange Adams, red Arapahoe, and greenish Douglas. And you can see that they've all gotten kind of low right now. They're all clustered around 3 to 4 to 5%. It's a little easier if you look at the table in the upper right. where Adams is currently in the past 2 weeks got a test positivity rate of 5.7, Arapahoe 4.4, Douglas 3.0. The magic threshold there is 5. If you're below 5, you're low. If you're above 5, you're not low. So the whole point of this is not to talk about variances and protect our neighbors, but it is to talk about what happens as incidence varies in our counties. Their latitude for being able to open businesses, increase capacities is impacted by what their incidence rates are, even if those incidences are occurring in young, healthy people that aren't getting as sick as the people were getting, as folks in nursing homes were getting back in March and April. Next slide, please. Just to sort of wrap up this, overall, what we see now is incidence rates rising slowly across our counties, like Colorado. Adams and Aurora have higher rates than Arapahoe does, and Douglas is the third place, not too much lower than Arapahoe, but clearly in a lower category. Thus far, we're seeing younger ages. We're seeing relatively low test positivity. That's good. And we're seeing no increase really of a clear-cut trend nature in hospitalizations and death thus far. That's really good. But given the rising incidence rates, implications of that, as already alluded to, is it could impact our capacities related to variances and eligibility for this new protect our neighbor status. Importantly, I spent an hour on the phone with the Douglas County School District yesterday, and will be doing something similar with Aurora soon, and have been meeting really with all of our school districts on trying to develop guidance for reopening, which of course you probably heard the president weigh in on yesterday. And it's pretty clear that as we begin to have rising rates in our communities, the challenges of school reopening will likely get more complicated. If for no other reason than if we've got more kids getting sick or more teachers getting sick, then schools are going to be really challenged as to how they do what they're really trying to do right now, which is full reopening. And that really hadn't sunk into me as clearly as it had until the last few days, when I began to sort of run the math with the schools about what it means to have an infected teacher whose classroom has to be quarantined for 2 weeks. And then the teacher next door is sick and that class has to be quarantined for 2 weeks. And all of a sudden you begin to get a domino where, these incredibly complicated plans that our schools are undergoing right now may get impacted. The last thing I would say is what we're seeing in the Sun Belt states that are really getting hard hit is that the higher rates certainly dampen down, if not reduce the plausibility of being able to contain infection by contact tracing. Already we're seeing that maybe only about 75% of folks really want to share contact information with us now. There's frankly reticence about doing this. And as that reticence, even if it doesn't grow, and as our delayed testing gets accelerated, and if we add on increased numbers of cases on top of it, the whole enterprise of trying to interview a case, identify their contacts, help the contacts get isolated and stay isolated begins to get much more challenging. Next slide, please. Which brings us to the topic of today. I want to talk to you a little bit again about the issue of why we should be considering enhancing face masks. What's the rationale for their use, and frankly, for a public health order mandating those. So you've gotten more than you probably wanted to know about new infections in Adams County and Aurora. So I won't touch on that one. I do want to mention that the compliance with the use of face coverings has not been increasing over the past several weeks, despite a vigorous educational campaign. Now, this is not a vigorous educational campaign that one might do if one had millions of dollars. This is not a new truck from Chevrolet or, a new hair product. I mean, we're talking, working on a reasonably tight budget, limited radio, no TV, no massive billboards, but trying to do selective targeting, a lot of social media targeting. And arguably, if one doesn't message vociferously enough, one cannot expect great outcomes. But we have been as cleverly and as cost effectively as we could doing that messaging. I think really importantly, since I talked to the board about 6 weeks ago about masks and their importance and whether we should issue a mandate, there's really growing evidence documenting the benefit of wearing masks. And really pretty much across the board, they're now being widely recommended as one of the key prevention steps in the absence of a vaccine. I want to go through a little detail in a second about a recent policy analysis that found that mandating masks actually was associated with reduced rates of infection and increased rates of mask usage. That's a policy analysis that nobody had done 6 weeks ago. It was just a best guess that doing a mandate was going to have a benefit. And now we have at least one study that's documented that. We have more and more states mandating mask wearing. There were 21 as of July 2nd as cases have risen. And you guys have heard the estimates. We had about 300,000 nationally in the last week. Dr. Fauci is predicting we could have as many as 100,000 a day in his recent Senate testimony. I would remind you that China's had about 85,000 cases in toto since the start of the epidemic. So we're experiencing almost as many in one day, or at least in 2 days, as China has experienced to date. And then finally, some, I think, very important information. There's strong both practical as well as modeling reason to believe that increased compliance with masks can support reopening the economy. I've tried to point out to you how the capacity limits of businesses that are open and the opportunity to open new facilities is tied to transmission rates in both the variance process as well as the protect our neighbor process. And there's a very interesting analysis that came out last Thursday evening, or maybe it was Thursday morning. Anyway, a lot of people missed it, 4th of July, Goldman Sachs. It was really an analysis done for their investors where they determined that masking mandates could increase national GDP by 5%. So a very, very large amount of impact on the economy. Next slide, please. So these are data looking at what Tri-County's been doing monitoring face masks. And let me begin by saying this is clearly imperfect. This is not the absolute capturing of reality, but it's the best that we could figure out to do. And frankly, it's better than any other state or any other county that's we've talked to in Colorado. And what we've been doing is sending volunteers to stores in different jurisdictions and basically sitting in a parking lot for half an hour with a clipboard, looking at who goes in with a mask and who goes in without a mask. And what you can probably not see is numbers across the top, but you can squint. It's a different color code. Adams is now purple. And Adams has clearly not just not gone up from a baseline of 84%. Adams has gone down and is now sort of logging in at about 59, 60%, which is potentially coincidental with its low or high incidence rates, but I don't think so. Arapahoe in yellow in the middle has sawtoothed around. It went up for the first couple of sampling weeks from 74 up to 86%, then it went down, then it went up, then it went down. This is almost certainly sampling error. Again, this is not rock solid week to week sampling. We don't have a trend there. But I think what we could say is that we have gotten at best around 85. We're probably really more realistically an average of about 80, which is a whole lot better than nothing. But we would like to, once again, in the absence of a vaccine, like to see that rate higher. And then finally, Douglas County has actually bounced around even less, has remained in the mid 70s, 77, 72, 77, 74, and has sort of hovered at about the same level throughout the 6-week sampling period. Next slide, please. So want to spend just a couple of minutes on this study that looked at the impact of state face mask mandates. And this was looking at a number of states that implemented mandates. This was not a randomized clinical trial. One does not do randomized clinical trials with policy. You either do it or you don't do it, and you try to do a pre-post analysis. Did it get better? Did it get worse? Or you try to do a comparison. In this case, the authors thought that it made more sense to do a pre-post, and that's what you see here. And so you can see whether it's to the right, any wearing a face mask or almost always wearing a face mask. The dotted line that, again, you can't even see it's dotted because it's so hard to read, but there's a vertical line, and that's when the mandate in these states went into place. And what happened after that was really in a matter of just days, certainly within a week or two, mask wearing began to go up, either sometimes or always on the left, or always mask wearing, which is the ideal. We'd like you to wear a mask anytime you're in a place where you could be transmitting infection. That went up even more dramatically. Now, again, I'd be the first to say that a single policy is kind of like a swallow in the spring. It doesn't make a spring or a summer, but it is far and away the best analysis we've got. And it is highly consistent with observations that have come from other countries around the world, which are also not randomized. But those countries, as I think many of you are aware, that adapted mask wearing earlier, and Southeast Asia is sort of the primo example because the population had been burned by SARS #1 back in the early 2000s. And it was not a weird thing for South Koreans, Chinese, Singaporeans, Taiwanese, and Hong Kong people to be wearing masks. They adopted it early at a point in time when we weren't so sure, and frankly, were giving not great public health messaging. Even the Surgeon General coming out saying they don't work, don't wear them. And then like 4 weeks after that, we changed our minds. And so if there has been confusion about masking, certainly public health messaging has been part of that. But I think as everybody is aware, it has unfortunately gotten to be politicized, and in a way that I've never seen a public health intervention fall prey to, but it's made the promotion of masking, I think, more challenging than it might otherwise be. Next slide, please. Now, this is the Goldman Sachs analysis. And again, it just came out last week. But what they did is, and I'm showing it back to back with the state policy analysis, because they took that state policy analysis and made projections based on it. And they made some assumptions that if masking increased on the either sometimes or always level as much as would seem, that the rate of reduction of coronavirus infection would very likely, based on what we know about mask benefit, would decline within a reasonable time frame that's quite similar to what you saw on the previous slide in terms of either COVID cases in the top. Again, you can't read this, or COVID fatalities in the bottom. Next slide, please. They then took that COVID reduction and ran an analysis looking at economic impact. And what they did is they first estimated the impact of a national mandate based upon what they had learned from that previous slide of a reduced daily COVID growth rate of 1.0 percentage points. PP. They projected, or they analyzed based on the graph to the right, that a similar reduction in prevention value would require a 16 percentage point increase in what they've termed, I've never heard this term before, the effective lockdown index, ELI. So basically they're saying, and what you see on the graph to the right is the experience of a number of countries, both in terms of how much their ELI was, that effective lockdown index. So China is like the most locked down and had the greatest impact. That's at the lower right corner. And I've circled the US example. So the US in April was at about a 65% effective lockdown index with an economic impact of about 15, 18%. Earlier, the US had been at about a 20%, that's a red circle, about a 20%, 22% effective lockdown index for about a 7, 8, 9% economic impact. Clearly, there's a relationship. Lockdowns cause economic pain. There's no question about that. It's not the whole story of the economy, as we see from places that have opened up. And the economy, which is linked to global supply chains and global trade, is still impacted, but it does impact the economy. There's no question. The green circle and that where the two red lines coincide is the Goldman Sachs projection. If you don't do a lockdown at all, but you do a national mask mandate, then you can get to not quite, but close to where the US was in March with our lockdown. Now, again, this is one model. These guys aren't public health people. They're just really savvy people that are trying to produce information for their investors. This is not a peer-reviewed analysis, but it's pretty intriguing. their conclusions were, because I don't think anybody believes we're likely to have a national mask mandate, that even in the absence of such, state and local efforts to broaden mask wearing through mandates could partially mimic the impact of a national mandate. But I think either way you slice it, national, state, local, the analysis suggests the economy could benefit significantly from such moves, especially, again, if the alternative ends up being a return to broader lockdowns, which nobody wants. We'd like to do whatever we can to avoid. This might be one way to try to get there. Next slide, please. One of the things I found interesting in the Goldman Sachs analysis was looking at survey data about mask wearing in contrast to our monitoring, where we go out and watch, and we can only watch people walking into big stores. This is asking everybody, what are you doing? And the dark blue is maybe the most important, the always, and Colorado's kind of in the middle. Minnesota, interestingly enough, has got the lowest when this survey data was collected in early June. Massachusetts had the highest, but the Colorado always of about 48% or so suggests that at least by then, we as a state, this is not a county analysis, certainly had room to improve. Next slide, please. I do want to note that the discussion we're having today is not unique to the Tri-County region. Boulder, Clear Creek, Denver, Eagle, Larimer, Route, Summit all now have mask mandates. Boulder and Denver went into effect around the time of the Safer at Home order initiation in May. The others have been more recent. In addition to that, Aspen, Fort Collins, Glenwood, North Glen, Superior, and Westminster all have their own ordinances. As of Monday evening, Inglewood also passed a local ordinance. And then finally, two big airports have got their own mandates where masks are required. Next slide, please. So now we move to the discussion part of the equation. And Rosanna, Jennifer, and I talked about sort of how to think about framing this discussion. I think what I'd like to hear discussion about is the potential for the board directing and authorizing Tri-County to issue a public health order for face coverings. And I'm thinking of, I've sort of outlined this by county and also by incidence level. That I am persuaded at this point that the situation incidence-wise and frankly overall political interest-wise, which I don't really want to consider politics as I make a scientific decision or at least offer scientific advice, but I do think it's real because I do think buy-in at the local level is important. I think we're all aware of folks who've said, not me, that's my constitutional rights, I'm not going to wear a mask, and if you make me, I'm even less likely to do it. And I think that's a real phenomenon. I don't know how to measure it, but I do think it's probably real. Therefore, I think that what would make sense at this point and what I'd like the board to discuss is the idea of mandating mask wearing in our highest incidence areas, Adams County and the city of Aurora, considering for Arapahoe County either an opt-out or an opt-in by interested jurisdictions. And the distinction took me a while when one of the mayors suggested this to me as an opt-out says, Tri-County issues a public health order requiring a mandate. Any county or any jurisdiction or county who wished to opt out could discuss, debate, and say, we think we don't need that. Our rates aren't high enough. We don't believe our citizens would comply, and vote to opt out. In distinction for that is opt-in. It's out there. You can ignore the offer to be part of this if you'd like, or you can vote, as the Inglewood City Council did the other day, to have, in that case, their own ordinance, but you could vote to opt in. And we are suggesting that both of those options be considered for Arapahoe County. And then finally, we are suggesting that we consider an opt-in for Douglas County. Douglas County does not have the highest rates. I think there is likely to be less interest in Douglas County. I haven't done a scientific poll, but I've talked to our commissioners and talked to some of the other elected officials. I think the appetite is less there. I do believe, honestly, that we would do better because we live in a very highly interconnected metro region if we were following similar prevention efforts in all of our counties. But again, I do get the fact that we have different jurisdictions. I also get very clearly that I'm not an elected official. Okay, I'm authorized by statute under the direction of my board to make public health decisions. But I also get the fact that I'm not elected, and I'm not really interested in superseding elected officials in circumstances where the situation is not as serious as it might be in an area with higher rates of incidence. So with that summary, Roseanne, I'm happy to turn it back over to you for the discussion.
Thank you, Dr. Douglas. We're going to open it for discussion. And I'm going to start with Douglas County. Zach Nonestad. Reversing the order that we usually go. Can you hear me? Zach?
Yes, I'm sorry. I don't know.
I'm sorry, was that a whole response?
He's muted. I don't know whether he can unmute himself or.
I heard him.
No, he did speak up and then he got muted.
He can unmute himself.
Yeah. Oh, wonderful. Paulette, thank you. I hope you're doing well.
I'm sorry. Can you hear me now?
Yes.
Can you repeat what the question on that you asked before you came to me?
We're discussing the considerations for Tri-County Health Department, possible motions. There's a variety of three options. Move to direct and authorize Dr. Douglas, to issue a public health order for face coverings for one or more of the following. 1, Adams and County and the City of Aurora mandated. 2, Arapahoe County opt out or opt in. Or Douglas County opt in by increased jurisdictions. We also can discuss, John, did you say something?
Interested jurisdiction, sorry.
Interested jurisdictions,
Yeah.
Thank you. There's also another option we can look at that arises from the board members.
Are you just asking for discussion at this point in time?
Yes, it's discussion, absolutely.
Yeah.
I do not have any discussion.
Okay, thank you. And Zach is the vice president of the Tri-County Health Department as well. Okay, Paulette?
So I like the way this is laid out, but I know that there's been some discussion that we are unelected bureaucrats and that we shouldn't be making decisions. So I would love to see the elected people, including mayors, the county people, make the decision if they feel that they have more information than the multitude of people in Tri-County who have done these studies and are doing this for the people to be able to not have to have a lockdown order. I think that it is a small thing to ask of people. Yes, there are medical reasons why some people can't wear masks, and that is something between you and your doctor. And, most of the time, if you say that you have a medical reason that you can't wear a mask, it's listened to. There have been cases where it hasn't been, but it is a small thing to do for others. And it isn't just the elderly who are getting this disease and dying. Just recently, there's been a highly publicized case of a young, healthy 6'4" man in excellent physical condition who died after 90 days on a ventilator. And so he was a 30-year-old. So we have to remember that it is not just the elderly who many people consider not important anymore. It is everyone who could get it and die from it. But it's also something that people should do for others. That's my feelings.
Thank you. Paulette, did you receive, because it came very shortly before, minutes before the meeting started, there was a letter from multiple mayors. Did you see that letter?
I did not see
In
that letter.
favor of face coverings. And again, I want to mention that it's face coverings. Mask is one version of it, but there are also a variety of type of face coverings, as we all know.
Right, there
Healthcare
are.
professions. So that may be something for you to see, because it was many, at least a dozen. There could be more. I didn't count them out.
And
That
were
in
they,
favor of our public health.
they were in favor?
Yes.
Yeah, that's great to hear, because I think we need to have that buy-in. People like Mike Kaufman should step up to the plate. And I know he has said he'll support us, but he, as the mayor, should be able to make a mandate also. But a lot of the officials don't want to do that because it's political for them. And I might point out, it is not political for us. It is medical. It is scientific. We have no political agenda.
Thank you, Paulette. Jennifer, was Mayor Kaufman on that letter as well? I know Mayor Kaufman has sent other correspondence in favor of a.
You look. Yes.
Yes, he
Mayor
is.
Kaufman. He is on
Yeah.
it.
Well, that's big of them.
Thank you, Paulette. Next, Marcia Jerwick.
Yes. First of all, I'd like to stipulate that I am in favor of wearing masks when you're inside establishments or retail establishments. I think at this point, all we have to counter or fight this disease is social distancing and the use of masks. But I am totally and completely against the health department mandating this. I believe that people in Adams County and the city of Aurora, that their elected officials should be the ones who have the same information that we have and are, as part of their being elected officials, their duties are to protect their citizenship, should be the ones to mandate this. Or to certainly encourage their retail establishments to do the same. I feel that Douglas County, our officials have come to the plate and taken responsibility for their citizenship. And I think the same needs to be done by the elected officials in these other areas. I don't think turfing it off to the health department, they may be supportive, but they want somebody else to take that task at hand. And I don't think that is our job to do that. I am very curious as to all of these supportive people. Have they identified why they don't want to be the ones to make that call? So I agree with Paulette that this isn't a political issue. It is a health issue, but I don't think that it's within our purview to mandate this, to have an order that would mandate masking, because I think whoever is the mandator has to be the police person, has to be the one out there monitoring and calling people to task. And I certainly don't want our staff to be the ones out there, identifying people and being the COVID cops who are calling people out. Thank you.
Thank you, Marcia. Okay. John, did you have any comment on that as far as the obligations for public health agencies to mitigate injury or disease?
I will say, I guess, a couple of things. I mean, obviously, I agree with Marcia and Paulette that wearing masks is important. I think the question is really, does a mandate help, and who should issue that mandate or that order? I will say that I have heard from a number of elected officials who feel that the order is stronger and more, what's the right word? Reputable is probably not the right word, but more credible if it comes from the public health authority versus a group of elected officials. That is certainly an argument that some have made. Marcia, I do think your point about enforcement is really important. We haven't really talked about what an order might look like. We would be working very hard to develop approaches that are similar to those used in other cities where this is 99% education. It's not really, frankly, even if we wanted to put public health people in the front line, it's not practical to send somebody down to the King Soopers on 4th and Main when somebody walks in and says, I'm going to shop here without wearing a mask. I mean, we can't literally get down there even if we were prepared to do that. That is a conversation I've begun to have with Aurora, given the mayor's interest in this, about how we outline what that looks like. I want to also say that I'm mindful of trying to do again, were this to be a mandate, to do this in a way that doesn't put businesses in harm's way. There have been concerns that if a clerk in a store is the one on the front lines telling a obstreperous patron you have to wear a mask or you can't come in, that they're sort of in potential danger. And we want to do everything we can to minimize that. So I guess I would say in wrap up, the hearing you and Paulette loud and clear about who ought to be making this choice, the argument that's been made is that the public health, if you will, voice has got more scientific credibility behind it.
Thank you.
John, can I just make one more small comment?
We need to move on. If it's
just one
quick,
comment. I have been doing some work up in Adams County and in Aurora recently. My question is, and maybe just for Adams County people, do people have enough masks? I mean, that would be one issue that I would be concerned about. That's all.
Thank you, Marcia. Arapahoe County. Going from reverse order, Dr. Kaya Gallagher.
Thank you, Rosanna. I'd just like to point out that this is a very difficult decision and an important one. The concerns I have are that there's more evidence that there is asymptomatic transmission, so that there are people who could be infected and are unaware that they are spreading the virus to other people. I also am very concerned about the cost of a potential lockdown in the fall. I worry that as our jurisdiction moves towards a time when we're more indoors, we open our schools, that we will face a challenge of once again trying to get the virus under control. In those respects, I believe that action taken right now can be very important and preventive. My preference would be to support the jurisdictions that want to opt in on this. Englewood has already done so. Aurora is interested in pushing in a mask mandate. The role of the health department, from my point of view, should be to provide information about hotspots and jurisdictions where it is important for the citizens to know, first of all, the increase in infection rates, and supply education about why this is really important. My preference would be not only to have an opt-in, an opt-in for the jurisdictions, but also if we move forward, I believe we should have a 2-week review of what is going on. The virus seems to be changing week to week. We are now seeing a slight increase. It would be interesting to understand if, in fact, the compliance with mask wearing is changing in any way, and whether we, in fact, need to take more action. It's important when the infections are increasing to take action such that, in fact, we can get ahead of the infection rather than just hoping that it will either flatten out or go away. So my preference would be an opt-in with a 2-week review.
Opt-in from whom?
Well, certainly Arapahoe County. I really can't speak to Adams County, the situation in Adams County.
Thank you, Kaya. Next is Dr. Tom Baywell.
Thank you.
I see you there. Okay.
Well, I have to say I'm conflicted on this for a few reasons. I'm in the very high risk category, so I'd have to say that's not the reason I'm a strong advocate for masks. I believe masks should be worn when and where they're going to be effective. Now, this requires, of course, having effective masks, which, although we monitor people going in and out of Walmart, we don't comment on how well they're wearing the mask or what they're wearing. So there's a different level of effectiveness depending on the masking material. Also, we know from scientific studies how the virus in droplets spreads and how it can stay on certain surfaces for a number of hours or days. And so masks become effective. You know, we have a history of mask wearing. In my 30 plus years as a surgeon, I probably spent innumerable hours with a mask on. I don't think any of you would want me to take you to surgery or your loved ones and have the OR team be maskless. That would simply increase the risk. And I think we're increasing the risk when we don't mask. However, that being said, I think a mandate for a region or a county is fruitless from the standpoint that I don't think it's going to increase the percentage of people who use masks. Our time for educating the public was at the beginning. And as Dr. Douglas pointed out, we just don't have the wherewithal to have a massive campaign, but that's what should have been done, because you're going to have a large percentage of the population who will wear masks. You have a significant segment of the population that will not wear masks no matter what you mandate. There are some that we might have changed their mind if we had some kind of educational campaign on the size of, say, the political campaigns, where every time you turned on the television or the radio, you heard the same thing over and over again. Sometimes those kind of promotions sink in, and we may have changed some people, but at this time, we're not going to change enough that the percentage will make any difference. I would go along with the opt-in type of approach for any jurisdiction that wishes to do that. But as has been said previously, enforcement is not going to really be something that has any teeth. And when you don't have any teeth, nobody who is against it worries about, gee, if I don't put a mask on, something's going to happen. They aren't going to do it.
Okay. Thank you. Next we have Jan. I don't see you on the screen. You must be down below. Okay, Jan Brainerd from Arapahoe County, RN.
Thank you. First of all, I'd like to.
There you are.
I'd like to. Can you hear me?
Yes.
I'd like to echo some of the things that my fellow board members mentioned. This has been a very difficult time for all of us. The board members have been called upon to make decisions, to research, and we've all been very diligent about trying to find as much information as we can. And we do look at it as a public health perspective, as was mentioned. I would agree with Kaya on the 2-week kind of, or maybe longer, because things are changing. We just had the 4th of July congregations, and it's really difficult to know it looks good. Then now we were doing really well because people were doing what they were supposed to do, those 3 easy things of social distancing, washing hands, and masks. It seemed to have worked. And then we had Memorial Day and other things that were happening, and it seemed to have done a little increase. We still seem to be, in my mind, we certainly are nowhere near the other states that are in dire straits where their ICUs are totally packed and almost at capacity. So I voted the last time we talked about this that we should hold off until we saw the metrics or the numbers change. I still believe that maybe they're not, and hopefully won't get to a point where we might have to come down with a mandate. I like the opt-in or opt-out. I'm still, as Dr. Faywell said, I'm conflicted because having been in the medical field my whole life, I do see the value of masks. Having seen many studies that mention that both directions is the efficacy of masks. Some of it may be related to how the masks are worn, because we've all seen people covering just their mouth, not their nose, and not being instructed. I listened to a webinar by one of the docs at CU Health on ethics and COVID. And he's one of the things about masks is the necessity of clear communication. If you don't give them, as Tom Faywell was saying, if you don't give them that education and the reasons for why you do it, I know there's been arguments, as he touched on, about you're not getting enough oxygen, and people unfortunately will take what they believe and they will run with it, and sometimes they refuse to either wear a mask if they don't believe them, or believe the studies that support their view. So I think we've seen some of the jurisdictions already take action on this. The mayor of Englewood, their city council met and decided. They had good information, and I'm hoping that the time and efforts put in by and the dedication by Tri-County people has provided so much information, and they're so willing to discuss things with people. And if the mayors and the heads of the jurisdictions would just rely on that to help make their decisions. So I'm kind of in the middle of, and one more thing, I know that people have heard this to the end, and man, I'm so happy that we never maxed out our ICUs, thanks to what people have done. And most people will do the socially responsible thing for their neighbors and their friends. If you have a different opinion, I respect that. If you can't wear a mask because you don't want to, or it's against your political or your whatever reasons, I respect you for that. If you don't want to wear it, don't wear it. But for most people, if they understand that we are trying to protect the community and everything, I'm not sure. I go with the opt-in or opt-out. I'm not sure which one, because I think if you do opt-in, interested jurisdictions will. If you opt-out, that kind of makes it a mandate. And if somebody doesn't really want to jurisdiction doesn't want to broach the subject, they don't have to. Whereas if you made it a mandate and they don't want it, then they would be forced to do what they want to do rather than just sit by and watch. And that's just my personal opinion.
Mm-hmm.
But
Jan, one particular point. I'm sorry, I didn't mean to interrupt.
No, that's okay. I just don't want to overwhelm the hospitals, because I've seen these doctors and nurses.
Yes.
And it's not fair. It's not fair to them. And we sometimes forget that is the end point of a lot of our things. People talk about herd immunity. Only 67% of the entire country has already been infected. So we have a long way to go to get to herd immunity, and we're going to wear out all those people trying to take care. They're doing great jobs now. The hospital capacities right now in the ICU, et cetera, are doing great. But I think it's because we came down in the beginning fast and furious. And one last point is that the people wanted us not to lock down, meaning the state, to lock down because of businesses. And yes, economics played a big part of that reasoning. And we saw businesses and restaurants lose their businesses, and some already are gone. But if we don't take care of this, and like Kaya said, be proactive for the fall, because they're thinking, because of many reasons, it may rear its ugly head even higher, we do run that risk of having to close down businesses, having to close down churches, which everyone worked so hard to get these open. And then, of course, we want to keep the schools open. So I think that, and I just want to quote one thing that Tom Hanks said yesterday, and he is a little worried because his antibodies are dropping since everyone knows he had COVID, and he's worried he may get it again. But he said, what I don't understand how something as simple as doing as little as wearing masks, social distancing, washing hands enters into such a fray of whether or not it is something we should all be doing in order to take care of our cities, communities, and each other.
Thank you, Jan. Thank you for that. I also do want to mention from our discussion with Jennifer and my discussion with Jennifer Ludwig and Dr. Douglas is that the municipalities have a system, but it's much more time lengthy than ours there. And I am not a elected city council person or municipal person, but theirs requires at least 3 readings and it's much more lengthy time. So that's something to consider because we have, emergent issues right now. So perhaps Julie can speak to that. Okay. Next, Julie Mullica.
All right. Can you hear me?
Adams County. Yes.
Okay. Thank you. So one of this, I actually just, for point of clarification, Rosanna, I have 3 questions for John. And then I have a comment several comments I'd like to make. So my first questions for John are, Dr. Douglas, where is Governor Polis on this issue? Have you heard anything? I know that you're on the GERT, and I'm sure this conversation has come up. Have we heard from him what his approach might be for the state instead of versus this piecemeal approach that we tend to continue to do here in Colorado?
I've heard a couple of things, Julie. First of all, I think the governor is quite interested in it. Why the governor doesn't want to take action himself actually isn't clear to me. Now, it may be deference to local jurisdictions. It was mentioned at some point that there was some legal ambiguity about whether the governor could issue either a statewide or a regional mask mandate. That was shared with me last week by Joe Ryan, and I haven't gotten confirmation about that. I do know the governor of Ohio, Mike DeWine, who issued a mask order about 2 months ago and then retracted it the next day because he got a lot of pushback, threats, et cetera, issued an order, 2 days ago for the 7 most highly impacted counties in Ohio. And again, states vary hugely. And so there may be statutory or constitutional reasons he can do that our governor can't. But that's my understanding at this point.
Okay. Thank you for that. And then another question that I have, and this is actually something that I think a lot of our local governments are going to be really interested in, is what does enforcement look like? And is that going to become a local government concern, or is there anything you could give us more information on what enforcement looks like for this if we choose to do a mandate?
So that's a really great question. And I would say that I don't have a totally fleshed out answer. I would say that in general, I believe the following. I believe it needs to be largely educational. I think the health department and the business community are ideally the primary purveyors of that information. When there are violations, I think that's where it gets more complicated. I do think that the businesses that experience the violation are on the front lines and actually probably have the greatest to benefit by their patrons wearing masks, because it's the workers who are in those settings that have the most to lose. What I want to do is, however, craft an order in a way that the business doesn't feel stranded. Some of you may have read Mayor Kaufman's statement yesterday that he didn't want the police department involved in that. And I totally agree. The police department almost certainly has more important things to do, but I do want there to be some sort of understanding of what someone on the front lines can do when one is dealing with an uncooperative patron who refuses to leave. I think there has to be some way of getting a fast response effort, probably by law enforcement involved with that. The third angle is whether or not complaints to the health department, and we should be receiving those complaints, have a role to play. I think they probably do. Some counties or jurisdictions have got language in their mandates saying that business licenses may be removed if they're not compliant with the order of having their patrons wear masks. I think there is probably some merit to considering that, but I also want to be really careful that behavior of folks that are out of the control of the business operator doesn't get used to penalize the business. I mean, we can all imagine how a business might turn a blind eye and things would be completely maskless. We could also imagine a situation where a business is actually trying to play it pretty straight for both adherence to the order as well as, frankly, their own self-protection, and there are people who slip through the cracks. So I do think, Julie, locals, I think, have to be involved in some way. I really do think it ought to be a minimal amount, both because of practicality as well as other priorities.
Okay. I think that helps, because I know that, you know, enforcement is a big question on everybody's mind. And I think we're all trying to get a better picture of what that looks like. And I do agree that it needs to be, you know, a conversation had with those local governments to figure out how are we really going to operationalize this is just an important step. My final question for you is actually about schools. Are you aware of any school districts in the metro area that are mandating masks for returning students, or is something like that possible?
Yeah, I know that DP at Denver Public Schools are going to be mandating masks. Well, this is what I've heard third hand, so I could be, okay. Take it for what it's worth, and that the Denver mandate will be used by the school system inside the schools. So it'll be sort of a seamless across Denver, including the school systems. It's my understanding that the same approach is going to be used in Boulder, which has got a mandate. Boulder's is a little different in that it's a 12-year-old cutoff. You have to wear a mask. You're mandated to wear a mask over 12. You're encouraged but not required if you're under 12. A little less clear to me how they're going to operationalize that in schools. We've gotten language from some of our other districts, including, let's say, Adams 12, where they've currently conveyed to us that masks are going to be required indoors and on buses, with guidance being developed about when designated mask breaks can happen. All the superintendents I've talked to believe, since they can't do 6-foot distancing, they're getting money for plexiglass. And their communities, for frankly, they would like to open as fully as possible in ways consistent with safety, that masking needs to be a big part of that. And so many are again developing language. Some will edge more toward the mandatory, and some will edge more toward the strongly encouraged. The goal is as much as possible. And I think the question is, for the X% who are not interested in doing that, will it be a mandate that the kid is required, or will the teacher have some flexibility to deal with that circumstance? And again, the teacher is almost like the business owner. They are a power figure in the classroom, obviously, but just like the store workers are at greatest risk for a non-mask wearing patron, the teachers are at greatest risk for non-mask wearing kids. Kids don't get sick, adults do.
Also, I believe Westminster Public Schools has initiated their plan to call for masks. Of the age range, I don't recall. This is Rosanna at this point, but Westminster.
Yeah, I could go on. Rosanna's right. Mapleton's got the same language.
Mapleton in Adams County.
Expected to wear masks. Cherry Creek, masks will be required inside the school to the greatest extent possible. Aurora, in their communication with the community, they state that masks will be required for all students 6th through 12th grade. So, and again, those Douglas has got a task force that's releasing some findings. They're going to be recommending wearing face coverings wherever possible. It looks like they're going to be coming more down on the side of strongly encouraged versus mandating. But again, these are early kind of snips in an email.
Surely.
Yeah. Okay, awesome. Great. Thank you so much. So I think one of several of the things that have been going through my mind during this conversation that we've been having is, and it's brought up a lot in the chat. So yes, I have been watching this chat as well to see what some of those comments have been and things that we've been emailed about. And I think one important thing, a couple important points I like to make is actually talking about roles here, talking about the purpose of this meeting today, talking about the purpose of this board, specifically because we are the board of Tri-County Health Department. Yes, we are not elected to this position. We have been appointed by our commissioners, frankly, because of our expertise in the area of public health. You know, kind of rising a little bit above the politics here, the Board of Public Health is supposed to be about health. That's our job. We're supposed to be promoting the health of the entire region, so all 3 counties. And so I think it's really important that although many of us maybe feel a little uncomfortable with this role that we've been put in place, it's still the role that exists, and it's the way that public health is run here in the state of Colorado. And so I think it's really important that we remember that we have a job we have to do here. And we have, you know, the health of our communities to be thinking about as we move forward. And so the reason why I asked specifically about schools is because, you know, as many of you know, I have two little ones. I have a 2nd grader and a kindergartner going to Adams 12 schools this fall. And so one of the biggest things I worry about as a mother is the community spread going to get bad enough, or is there going to be outbreaks in our schools to the point of where we actually have to pull those kids out again? Now, having to go through what we went through last spring, it was devastating for my child, my 1st grader. And, you know, it really disrupts their education and learning process. So for me, I want to try and figure out how, as a community, can we support these teachers and these kids as they go back next month? And how do we continue to protect, you know, those most vulnerable in our community? We're still seeing many outbreaks in our nursing homes, in our senior living areas, and, you know, throughout our communities. And so it's really important that we continue to be thoughtful how we're protecting our community through this. So one of the things that I actually would like to try and discuss with this group is, because our role here as a Tri-County Board of Health is to talk about health and to make decisions based off health, based off data, based off science, is there support from this board perhaps to create a 3-county mandate for masking with an opt-out clause? So for example, those local jurisdictions who are adamant that, you know, they don't believe that they need masking in their communities, they could choose to opt out of this mandate. So if I want to throw that out there as an option, because our decisions should be based off of science. And I'm sorry, there needs to be somebody who needs to mute their phone. Thank you. And so our decisions are based off science, and our job is to decide based off of the science and the experts that we're hearing from, how do we make the best decisions for the health of our communities? I think we've heard from several board members today that masking, they agree with masking, they support masking. So politics aside, that should be the uniform message from this board for our 3 jurisdictions. Now, we also understand, you know, the reality of it. There are lots of politics at play here. And so maybe giving that local jurisdictions, local governments, the opportunity to opt out, that's a conversation they could have in their communities. But our stance is the same. Everybody should be wearing a mask across the Tri-County area. That's all I have. Thank you.
Thank you, Julie. Next, we have RJ Delaney, Richard Delaney, Adams County.
Yes. Good morning, everybody. And I agree with Julie. I believe we should mandate masks across all 3 counties. This is a public health issue. The public is at risk. And as Dr. Gallagher indicated, there are asymptomatic people in the community potentially spreading COVID-19 to anybody they come in contact with if they're not wearing a mask. And the testing right now is delayed. So you could have a test today and not get the results for 5 to 10 days. And during that time, you could be spreading the disease if you interact in your community without a mask. The virus doesn't recognize political jurisdictions. I believe we should mandate a mask across all 3 counties.
That's it.
That's
Thank
it.
you. Thank you. Thank you so much. Next, I'm myself, Rosanna. I'm an Adams County representative, and I am in agreement with Julie and RJ and Kaya on a couple of different points. In Adams County, we have a younger population.
Listen to all the board members talk. It's pretty divided.
Hello? Someone needs to be muted.
I got
Did
him.
you get that, Renee? Okay. We have a younger population that we serve, although we do have a significant seniors and people intergenerational living as well. We have many folks that are essential workers in Adams County going to work caring for the public, whether that be in the grocery stores, in a manufacturing or business, in long-term care facilities, in a variety of professions, and that shows in the maps regarding mobility. We also need to look at areas of health equity, and we haven't mentioned that to date or this morning. Latinx residents have been affected at a much higher rate in contracting COVID and hospitalizations. So we need to be considerate of that, particularly in these times where we're looking at health inequities. We need to consider that's our role as public health board members. Also, the Black community has been affected, not only in Adams County and Arapahoe County as well, and across the nation, being hit hard. And that's an area of responsibility that we have as public health board members, is to represent those folks. Speaking about whether there's enough masks, I know in Adams County and Arapahoe and other counties that there have many, there's some municipalities that provided those to their public, as well as many nonprofits that I know I've been involved with that are working to provide masks. Because as Dr. Gallagher brought up, yes, there is a question whether there's enough masks, and it's something that we all need to be interested in as you know, representatives in our counties. So I'm in favor. I think part of our duties as public health practice and board members is to ensure that infectious diseases are monitored and investigated. That's part of the core functions, and that will take place and has been taking place by those in Tri-County as well. One of our duties is to look at hazards that cause injury and that diseases are mitigated. And mitigation, there's numerous things: washing our hands, wearing face coverings, maintaining social distance. I know my particular eye physician requires a 10-foot social distancing, which to her credit. So I am in favor of a face coverings mandate. That's our public health duty. I would be interested in an opt-out mechanism for interested jurisdictions, but definitely we need to take a look at how this has been affecting, and that information is available on the Tri-County website. I know we added some other municipalities, Centennial and Arapahoe County was one of particular interest to myself as well. So that is my opinion, and I'm waiting for a motion. Hear a motion.
I'll make a motion, Rosanna.
Okay.
This is Julie.
Mm-hmm.
So I move to direct and authorize the executive director of Tri-County Health Department to issue a public health order for face coverings for all 3 counties, Adams, Arapahoe, and Douglas County, with an opt-out clause that could be made on behalf of local governments.
Tyrant. All of you are tyrants.
This is Richard, RJ.
Thank you.
Has that been seconded?
Thank you, Jan.
Has it been seconded?
Yes, Mr. Delaney, RJ Delaney seconded that. Mm-hmm.
Can we have some discussion about that particular one?
Absolutely.
Just a quick comment.
Was that Jan or John?
Oh, sorry, it's Jan. No, I am in agreement with what was put forth. The question I have is, will there be any parameters for opt-out? There are parameters for moving into the next phase, which everyone's trying to get their counties and their cities in a good position to do that, et cetera. But will there be any kind of guidance, if you will, or parameters for a city to opt out other than just saying we opt out? That's all I was asking.
John or Jennifer, will you answer that?
I'll take a shot at that, although it's Julie's motion.
It's a big one.
Clarify, and if we could ask everybody not speaking to mute, it's easy to get staticky. Rosanna and Jen, what we had thought about was if the opt-out mechanism was chosen, and I'm not an expert in this at all, is that we would draft an order. That order would be drafted to go into effect probably, X weeks, not immediately, but X weeks after it was released. All jurisdictions, and we were envisioning both counties as well as cities, because the commissioners have explained to me that they really all have jurisdiction over only the unincorporated parts of their counties. So we have 26 municipalities and we have 3 counties. And so that would be really honestly up to 29 different entities voting by their boards as to whether they wanted to opt out or not. If they did not vote to opt out, then the mandate would be in effect for whatever jurisdictions did not vote to opt out. That's how I understand it. I don't know if Julie has a different thought.
Yeah, well, and that was my intention with the opt-out option, because I know that there are many communities that, want to have a discussion locally about what this means for them and their impact on their community. And local governments are the people who make those decisions. And they're the best equipped to have that conversation. Their ask from us, from what I've heard from elected officials and from our county commissioners, is we as a board make the best public health decision. The best public health decision for us, I think many people on this board expressed, is that we should all wear masks. By doing this, we're saying everyone should wear a mask because the science proves it, and we want to control spread in our communities. That discussion, if they choose to opt out, could happen on a local level. And I feel like that way it gives, community members an opportunity to make their case in front of their city councils.
Rosanna, I'd like to propose an amendment, and I assume that since my amendment is different from what Julia's proposed, it may be that we need 2 separate votes, one on Julie's proposal and then one on this amendment. My amendment would be that the mandate for masks apply to those areas that have the highest incidence of the virus. And for the present time, that appears to be Adams County. For the remaining jurisdictions, I would like to propose an opt-in procedure where those areas that have shown a need for a mask mandate have the ability to act quickly to be able to protect their citizens. And rather than apply the requirement for a mask mandate across all 3 counties, I would propose that we look more specifically at those areas that have the highest rates of infection.
This is Rosanna. I would not, we're still in discussion, so the amendment has not been accepted, so we're still in discussion about the first motion. I want to talk about what I was in agreement with Tom about education. There's been many, with our modest resources, Tri-County has been offering education in the use of face coverings, as well as the other areas to mitigate COVID-19, hand washing, social distancing, as well as many, many other entities such as the CDC has many things. I avail myself of Spanish language media, including digital. There has been many by the community groups and the stations themselves in digital messaging, the old school television, as well as radio, online, and the regular radio as well. So there are campaigns from a variety of resources. Of course, it could be better, and I would call for us being able to look at whatever resources there are to do that. So that's something I wanted to address before we got off on another area. But yes, certainly education in multiple languages. I know there's other digital media campaigns out there as well. I know I've seen at least 6 different languages, including simplified Chinese, Korean, Vietnamese, what was the other one? Russian, Ukrainian, and some others. So thank you to all of those public health groups, or excuse me, nonprofits that are working on that as well. Can you hear me still? Okay. I think, Julie, I think we need to be very careful when we talk about looking at rates and having big opt-out areas because people are so mobile. So. Back to you, Julie.
Well, I have no other discussion on the motion that's placed. I know Kaya is allowed to make an amendment to the motion that I've passed. If that is seconded, then we could vote on her amendment.
If you accept it, the amendment, that's what I did not hear a second on her amendment. If it's a friendly amendment, Kaya, somehow my screen has moved.
Second.
Okay, now we're back. Okay.
So I guess I'm unclear on what the amendment might be.
Yes,
specifically again, Kaya, if you'd like to.
Yes, my amendment would be that I would authorize the director of the Tri-County Health Department to issue a public health order for face coverings that applies to the areas in the Tri-County jurisdictions that have the highest rates of coronavirus infection. At the current time, that is Adams County. In the remaining areas, I would propose that the Tri-County Health Department provide support and education related to the value of face coverings and allow for an opt-in for those jurisdictions that are interested in issuing a mask mandate.
Kaya, just to be clear, you are suggesting Adams be the mandate, but not Aurora as well, correct?
Aurora would be allowed to opt in under my amendment.
Okay.
Okay.
Okay. So for me, at least, unless it's seconded by somebody else and we could vote on that amendment, for me, I would not consider that a friendly amendment to the motion I already put forward.
Thank you.
I agree with Julie.
Mm-hmm. Thank you. Okay, so hearing no second, we're going to move on. Discuss. Is there any more discussion regarding Julie's amendment? Julie's motion, excuse me. So the friendly amendment does not proceed on.
So I'd like to be clear. We are saying that Arapahoe counties would have a mandate with opt-out available, and Douglas County the same thing. Is that what you're saying, Julie?
Yes. So it would be a mask mandate for all 3 counties with an opt-out option for local jurisdictions to decide.
Okay. And are we going to allow Adams and Aurora to have an opt-out?
Yeah, I think that any local jurisdiction who is passionate enough to opt out, then they should be given the opportunity to do so. But as a Tri-County Board of Health, our message is very clear that we recommend that everybody wear a mask.
Okay.
Can I ask a question?
Pardon me? Who is this speaking?
This is Francoise.
No,
can I
ma'am.
ask a
I'm
question?
sorry. No, this is strictly the time for the Board of Health folks to be discussing I appreciate your interest, but this is a time for the Board of Health members only. Thank you.
I'm not
Okay.
asking, I'm telling you, you need to read the chat. No one is agreeing with these amendments that you're putting in place. No one
Renee,
is
could
agreeing
you
with
please
anything.
delete those? Mute. Thank you. Okay.
Rosanna?
I think
Hi,
we should
Jan.
make sure that they know that we
Can you
are.
believe these unelected tyrants? You guys, thanks.
We
Rosanna,
are reading
Okay.
the chat.
Hi, Jan. Paulette, I see you now too. Okay.
Okay, I
Sorry.
just like to.
Don't ask for permission to interrupt.
Jan, I think you were first, or Paulette, were you first?
I think Jen was first.
I don't
Okay,
know.
Jen.
I think we should just maybe go through what mask wearing entails. A lot of people were concerned that that we were mandating masks, that every moment they stepped out of their house, they had to have the mask on. And I think that some people are mistaken in what the mask mandate would include, and maybe a general statement to help people with that would be helpful as to what that includes.
That's an excellent point. John, could you please discuss that, or where we are with that?
Yeah, that's quite reasonable. In general, Jan, the mandates have had language such as masks or face coverings are required if you are in an indoor public space where other people are present, or if you are in an outdoor public space where 6 feet of social distancing cannot be assured and maintained. So the idea is pretty much everywhere indoors where other people are present, not limited to 6 feet. This increasing information about potential aerosol as well as respiratory droplet transmission, I think, makes the indoor space more concerning. But in outdoors, it's when you're within 6 feet of other, or can't assure that distance from other people. So if you're walking out of your house to go take a walk, you need a mask with you, but you don't have to wear it until you are close to other. But
even inside, people are more than 6 feet apart.
Renee, please remove that individual speaking out of turn. Thank you.
So my comment, Roseanne, was to say that we are definitely seeing and reading the comments. And I don't want people to think that we're not seeing them or reading them. And there are people commenting who support the mandate and are being reasonable about supporting the mandate or putting their other ideas on there. There has been misinformation on there. In particular, cloth masks have been studied some and have found to be very effective, not as effective, obviously, as the medical masks, but you know, there is definitely some protection. That's it.
Thank you, Paul. That's an excellent point for bringing forward. Okay.
Rosanna, I'd just like to ask a question. When we take a vote on Julie's motion that would require a mandate across all 3 of our counties, if the motion fails, the default would be that Tri-County would just merely strongly recommend that everybody wear a mask. Is that not correct?
No, that's not correct. Then we would take up another motion. In my opinion, yes. It is our duty as public health board members representing and governance over the local public health agencies to mitigate disease, monitor, and prevent the spread of disease. So that would be my.
It's not spreading. It's already It's already mitigated.
Renee, please mute or remove that phone number. Thank you. Okay. Okay. Julie, would you like to read that back, or Renee? Who has that? Read back the motion as it stands.
So the motion that I have is, let's see, this is from May. Sorry, scrolling back up. There's been a lot of conversation.
Sure, I'm trying to. Mhm.
All right, so Julie Mollica has moved to direct and authorize the executive director of TCHD to issue a public health order for face coverings for all 3 counties in Tri-County Health Department's jurisdiction, those being Adams, Arapahoe, and Douglas counties. However, all municipalities and counties in the jurisdiction have the ability to opt out. I'm sorry, could you guys hear me?
No, could you repeat that last part?
Communists.
Please remove that individual from the meeting.
Oh, he's gone.
Thank you.
Basically, in a nutshell, Julie moved to basically direct and authorize the executive director of Tri-County Health Department to issue a mandatory mask order for all 3 counties in our jurisdiction. However, municipalities do have the ability to opt out. Is that correct, Julie?
Yes, that is my motion.
Okay. Tom, did you have a, I see your finger.
Yes.
Thank you.
Yes. We're considering this mandate. And I'd just like to ask John, when we instituted stay at home and safer at home phases, it was done to reduce or flatten the curve and to allow the hospitals to deal with the influx of the severely ill. And with that, did we not expect an uptick, a slight increase as soon as we got past those? And are we not reacting to something that we already expected?
That was for me, Tom?
Yes.
Yes. Yes, we did expect it. A big part of the caution in terms of gradually reopening has been to reduce that. But we knew that was not going to go away as a threat as long as the virus was circulating. We are therefore reacting to something we expected. The reason it makes sense to me to raise this discussion today was that we are seeing increased incidence. We have better data that masks are effective in preventing transmission. We have data that mask policy mandates by states have resulted in increased wearing and probably reduced infection rates. And we have growing economic, probably educational reasons to believe that keeping transmission as low as possible will enhance business reopening and school reopening. So that's what's different in terms of what we always expected.
So, taking each point, an argument could be made other than with a mandate, there's been an increase of mask wearing. I think that would be in jurisdictions or states where education has been to a greater degree than we were able to do. If you look at some of the graphs that have been presented today, like Goldman Sachs, you superimpose those over our graphs of cases and they match. That would at least call into question the Goldman Sachs supposition that by doing this, you get that.
Commies.
It isn't a cause and effect situation, which is the basis for a scientific approach. And I think until we get into much more detail, it's hard for me to accept that just doing this is going to make that much of a difference. But that's just my point of view, and it's usually a minority point. I'll turn it back to Rosanna.
Can I ask a question? This is Marcia.
Yes, Marcia. Please do. Marcia, please do. Marcia disappeared on me. Where is it?
Rosanna, I've got a question while we're waiting for.
Thank you.
Is there a timeline associated with this?
And it wasn't a part of the original motion, Julie?
Yeah, it's not part of the original motion. I mean, we could talk about what the timeline would be and or, you know, we could talk about reevaluating after a time that the board agrees could be helpful. I'm open to ideas here, guys.
Again, we have given John, Dr. Douglas, the charge as the executive director of Tri-County Health Department to initiate this order and follow this order through. So, and other motions we have public health orders, we've had a time limit, and others we have not had strict time limit. So I, for one, I think we need to do something a bit beyond what we have done in the past. We've had 2-week orders, etc., because people do need to be able to look to the public health order, digest it, and we need to give the municipalities, I understand it takes longer for them to opt out more times. John, do you have a point about that?
Well, Zach, in terms of the time question, there are time considerations on both ends. I think if we did the opt-out, we'd have to have two-time things to think about. One is the actual crafting of the order. And as I mentioned earlier, enforcement is an issue. And we would want to explore what we thought was a reasonable enforcement protocol before the order was released. Then we would have to have a time frame that would allow a jurisdiction, reasonable time to opt out. It's not like if you don't opt out by tomorrow, it's a done deal. And I think we'd have to decide what that reasonable time frame would be. I think on the one hand, we could say, let's wait till the new year, but that's an absurdly delayed thing. We'd want to do it, I think, within a matter of several weeks, which would be, hopefully realistic enough to allow those who have to take proactive efforts to opt out, but without delaying the whole reason we're entertaining is to try to have prevention efforts move as rapidly as possible. Then the next issue is how long. And, models from other places have established durations of 30 days, 60 days, 90 days. More recent examples in Boulder, and I think also Denver, have made the duration open-ended with the idea that there is no foreseeable end to the COVID epidemic. There could well be some emerging data that says something else is so much better, we don't need this, at which point that mandate would be discussed with the board and retracted. So, but if the board were to be more comfortable with not open-ended, we could certainly set up a time frame, and then that could be revisited in 60, 90, 120 days.
This is Marcia. I'd like to make just a couple comments, if I may. First of all, I thought in the past we had talked, because we now have information, we're not going to be doing a shotgun approach to things, which this certainly seems to be. I'd also like to make the statement, it is not political where either side is coming from. It is from a healthcare perspective, but it also involves what is the role of the health department here. And it also seems to me that there are so many unanswered questions that are being raised. I don't know how we could legitimately even vote on any sort of a proposal at this point in time. Thank you.
Thank you, Marcia. Julie?
Yeah. So one of the things I would like to try and add to my motion, and Renee, is it possible to display perhaps maybe like on a Word document or something where you share your screen, the current motion that's before the committee or before the board, just so that we're all on the same page. I think it helps just to kind of see it visually. If that's possible, that would be great. Another thing I would like to add is perhaps language to Zach's point of, because this is something that we're going to need to reevaluate over time, I'd like to put that language into the motion, so that, you know, the executive director, John, would be, you know, given the opportunity to evaluate, and I know he's going to do this anyway because that's what he does, he's great at his job, evaluate this mask mandate across the 3 counties, perhaps, you know, every 30, 60, 90 days. And then he could advise the board on when it would be appropriate to lift the mandate, because we're not really quite sure what's going to happen in the months coming up ahead. And we also need to remember that there is a flu season that will definitely be happening as well. So I do see this as something that's going to be extending.
Wear masks forever, even for the flu. Wear masks even for the.
And so it is something that we just need to look at. We need to look at the data as it comes moving forward. We are moving into a heavy respiratory season. So it's just something that we're gonna have to review, and kind of leave open to what happens in our community.
Hey, Jennifer, are we going to be able to get somebody to write this on the screen? I think.
Yeah, we're working on it. We just
Okay.
had to unshare a screen, so we'll get it up.
Yeah, and I'm working on it too. Just give me a minute. I've got people interrupting from the public and text messages from other people, and
All right.
it's kind of crazy. So be patient, and I'm working on it.
Okay.
Thank you so much.
Thank you, Renee. Thank you, Jennifer, and others, Tri-County staff who are there. I know you guys have had a very long extended work hours and weekends, so I really appreciate your patience with us during this time. Zach, does that help you?
Yes, I just wanted to make sure that this wasn't open-ended. That was quite a few things that I saw in the chat, was that we didn't want this to be indefinite.
Yes, thank you.
While we're waiting, were there any other questions or concerns from the board, or other discussions that anyone wanted me specifically to address?
You know, while people are thinking, Marcia said there are a number of questions that she thought it would be important to consider. And I wonder if maybe, I mean, we've got the motion up now, but perhaps she could begin to list those. That would be helpful to me and maybe to the board as well.
Sorry, John, what was your question again? My audio.
Well, we can go back to the motion, but I just said Marcia had said, in one of her comments was, gosh, there's so many questions to be discussed. Maybe it's premature to make this decision. And I would be helpful to understand what those questions are, as Marcia sees it and others see it as well.
You guys still see the motion?
No, it moved to minutes.
Okay, all right. Sorry, I have multiple screens and I'm trying to move stuff around.
Ronnie, this is Jennifer. If you want to, oh, there we go. But if you need your other screen, you can stop share and I'll pull it up.
Oh, no, I have it. We're good now, I think. I just can't tell what you guys are seeing without asking. So now I know it's working.
Okay, great.
Are you asking what questions I might have?
Well, that's what I was suggesting. This is the board's discussion, not mine. So I want to be careful what I interject. I just thought you made an interesting point.
Well, I mean, we have I mean, how many amendments and proposals do we have out there? And no one knows how long it's going to last or who it's going to affect or why we are doing this rather than people that have been elected to do the job, but they don't want to do it. So now we're taking it over. I mean, there are a lot of unanswered questions and issues out there. And how do people feel comfortable voting? Maybe everyone else does. So I guess we'll do what we're going to do.
Okay, Julie, can you see that?
Actually, can you zoom in?
Or
it's a little small.
Okay. Okay.
That helps. Thank you so much.
You're welcome.
I think that the new thing simplifies things, and I agree that we cannot let people force us to do what is not our scientific reasoning. You know, Julie, you're an infectious disease person. You know, we have some high level people. We have 3 doctors. And Julie, are you a doctor also?
I am not a doctor. No.
Okay.
Just lots of public health and epi experience.
Yeah. And, you know, I've got 50 years of nursing experience, and I think we've got a nurse practitioner. I mean, we've got people who know what they're doing and keep up with the scientific evidence, and we need to not let people scare us off. So, and the jurisdictions have the right to opt out. So if they choose to do that, they can do that. And by the way, there's been a lot of discussion by the people saying that Tri-County doesn't have jurisdiction. And Dr. Douglas, I wonder if you could explain the jurisdiction you have in this pandemic.
Sure, Paul, I'm going to take a stab at that. I don't know if our attorney Sid Overton's on the line. He was here at one point. I don't know the statute numbers. The Colorado State Public Health statutes in a couple of different places give a local public health department, in the event of a public health emergency, the power to enact public health orders to reduce transmission and preserve health. Those are not direct quotes. In the case of those powers are received or transmitted, if you will, to the Director of Public Health via the Board of Health. So the Board of Health has got statutory authority to take action in the events of public health emergencies to prevent transmission of its infectious disease or to prevent severe health outcomes. And so at least originally, the notion is that there's the statutory power for the board, which is why the board has to, which is why I don't just run with it. The board has to direct and authorize me to take a step like this. Sid, I don't know if you're still on the line. I know you were there at one point. And if there's anything I've said that could be better clarified, please step up. And
John, while Sid's there, I have in front of me the Colorado Public Health Act of 2008. Of course, there are many other places in the state constitution from many, many years ago, but it's Colorado CRS 25-1-501 at ETSEQ. This is Rosanna. The Colorado Public Health Act.
Dr. Douglas and board members, can you hear me?
Yes.
Yeah, I'll respond and just state that the authority of this board, Board of Health, and the Tri-County Health Department has jurisdiction in this matter entirely, but not exclusively. And you have to go to CRS 25-1-110, and it's very short, so I'll read it to you. It says, nothing in this part, which would be the public health law, shall prevent any incorporated city and county, town, county, or other political subdivision of the state from imposing and enforcing higher standards that are imposed in this part, which means that every city and county and subdivision also have authority to act in this area. And it's not exclusive to Tri-County Health Department. But Tri-County does have jurisdiction.
Thank you, Sid.
Madam Chair?
Hey, Renee, can I just, this is Julie. One thing I'd like to add, we didn't put in here on your screen the ability of the executive director to review and put an end to this order either. So, or is that implied in his power as executive director? I guess is another question. Or how do we specify that here?
Sounds like you guys might be clearer just to specify the order expires after X amount of time. That's real clear, and I think it would address Zach's concern. Some language about it expires unless extended, which is often what's done with these sort of orders.
Madam Chair, Dr. Douglas? This is
Rosanna, this is Jennifer. Can I ask a clarifying question of the motion of Julie?
Please do, and then I saw someone, that was another comment. Yes, please.
Okay, we have municipality up there, which would exclude counties from being able to opt out, or unincorporated areas. That would only be an incorporated municipality. And I don't know that that was the intent of the opt-out clause. That's, I think, how we captured it in the motion. But if we could please clarify to make sure that an entire county, thank you. And actually, Julie, is that acceptable for your motion?
So I guess, yeah, that's an important point to kind of clarify. For me, yeah, so when you say county, that includes the unincorporated areas of that county, correct? It doesn't include municipalities, because municipalities are home rule authorities who have the ability to make their own decisions. Okay.
Yes, I think this is Rosanna. Yes, I believe that was in your discussion for counties, because we have unincorporated areas in Adams, Arapahoe, and Douglas, where the counties have. Maybe
yeah, thank you for that point of clarification.
The county commissioners have a.
Yeah, no, that makes sense.
Jurisdiction. Yes, that was in John's point.
Yeah, that makes sense. Thank you for that point of clarification.
Thank you.
Madam Chair,
so and as for the time frame conversation, is there a way that to do a time? I guess to be if John's suggestion is to actually, yes, this is Julie. Sorry. If it's John's suggestion to put like a
I think Julie got dropped. This is Rosanna. I think Julie's got dropped somehow.
I did get dropped. I'm sorry about that. If the point is to put a time frame to this, I would have remains in effect until, can we do a 90-day time frame for reevaluation at that point?
You know, I think we can do whatever the board thinks is appropriate. The governor often issues orders in 30-day boluses or units of time, and then with the language, the order will expire within 30 days from the date of its implementation unless otherwise extended, or something like that. So there's no magic to 30.
Okay, well, let's.
But
yeah, let's adopt similar language to what we've been seeing from the public health orders coming from the governor. I think that could be helpful, just to be consistent for the.
Sid, did you have a point?
Yes, I think it's important to clarify when the effective date of the order is, if assuming that there will be an order, that effective date when it commences, so that all jurisdictions know their opportunity. If they decide to opt out, they'll have an opportunity to do it within a reasonable time. And then, of course, the expiration date's also important. I think you've already mentioned that either 30, 60, or 90 days. So both of those dates are really helpful for clarity for the public.
I do think that when the governor's issued orders, it's not been quite as complicated as the scenario we're envisioning, where we're going to have presumably a several week period for counties to opt out. And so if it takes 3 weeks to work through that, 30 might be a little short. Although, again, that's the board's call.
Okay. I'm sorry, you said this is Rosanna. You said 30 might be a little short.
Well, it may take us, 21 days to allow counties to opt out. And we've talked about giving a certain amount of time for a county who doesn't, or a city who doesn't want to be part of this to get out of it. And I just was guesstimating 3 weeks. But if we did that, then is 30 days, do you want it to be longer than that? If it's 3 weeks to get to it, is 30 long enough to be meaningful?
Okay, so in that suggestion, John, can we just do the 90 days? Because it sounds like your implementation date should be, what are you recommending for a realistic implementation date? Would it be 3 weeks from now? Would it be tomorrow? How would this be operationalized?
Julie, I don't know how long it would take, for example, your city council to opt out, if you wish to opt out. Now, you have your own ordinance, so that's a little moot, but that was the concern, is to give a fair amount of time for a jurisdiction to do whatever they need to do to opt out if they don't want to be part of it. And I just made up 3 weeks. I don't know really what that appropriate length of time would be. And so one idea would be to allow us to explore that. And as Sid said, the order we would figure out what a reasonable amount of time is. We would put out the order with the date to commence after that reasonable amount of time, with the board's direction that it expire within 30, 60, 90, whatever after it's implemented. Does that make sense?
Yeah, I think that's fair. Yeah, that makes sense to me. Does that make sense to everyone else on the?
This is Rosanna. I agree. Let's give a moment to hear from the others, board members.
Do we take a vote?
Can I?
Go ahead, Zach.
I had to step away for a moment. Did we vote?
No, we have not yet.
Okay, good.
I would like us to revert back to the original motion. And if I need to do it as a substitute motion, so be it. I think we need to go back to where the original motion was talking about Adams County and Aurora. Can we do that with a substitute motion?
No, we cannot. This is run by Robert's Rules of Order. Madam Chairman, I call the question and request a vote.
Second.
Okay. All those in favor? I see another. Is that you, Paulette? Okay.
Who seconded?
Marcia.
I did not.
Marcia seconded, correct?
You don't need to second that.
Okay. Okay, although in favor of moving to direct and authorize the Executive Director of Tri-County Health Department to issue a public health order for face coverings for all 3 counties, Adams, Arapahoe, and Douglas, with an opt-out clause for any municipality or county in Tri-County Health jurisdiction. Further, this order will expire 90 days from its implementation date unless extended by the Executive Director of Tri-County Health Department. All those in favor of passing the motion, please say aye. Aye.
Aye.
Aye. Aye from Richard R.J. Delaney. Aye.
Paulette, aye.
This is Jan. I just needed clarification. I heard a lot of conversation, the last part of it. Okay. 90 days.
Okay, you want me to read it again, Jane?
No
It's on the
withdrawal.
screen.
Sorry.
Can you see it on your screen? Pull it up. I don't know if it's big enough.
I'm just trying to understand the discussion. I got lost in that last part about the order expires 90 days was extended. Does that also, I thought there was some discussion about if the director rescinded at his discretion at an earlier point.
Yeah,
Sorry.
Julie, you want to speak to that?
I'm just having trouble with the 90 days. Not with the particular order.
Yeah, well, I think so we wanted to put a time frame on it. We're going to look at this for 90 days and evaluate our situation, and then the ability to extend it, because we were talking implementation, so maybe 3 weeks.
Julie, you're breaking up. Are you by your router?
I am close. Can you hear me now? Sorry, guys. Can you hear me?
Better.
Can you hear me?
Yes.
Okay. So the point was to put an end date to this, and so that's why we chose the 90 days.
Disabled.
With the understanding that it could take at least up to 3 weeks to implement.
Now we can't hear. Julie, yeah, go ahead.
Rosanna, is there an opportunity to do a roll call vote?
Yeah, let's do that.
It's Julie? Yes. We can certainly do
Yeah,
it.
that's Julie.
Yes. Did you hear that last part, Jan, satisfactorily?
Yeah, I just was not confused, trying to figure out, is there the ability for it to be in 90 days, sometime maybe in 60 days, for the executive director to rescind it or reevaluate it?
Yes, I believe so.
I didn't see that in the motion, and I just think 90 days is a long time to have this without reevaluating.
Julie, quickly, can you speak to that? Otherwise, we do have a call for the question, I believe.
What about sexual assault victims? They can't.
Please remove that individual from the discussion.
Okay. So what I would like to try and do is, how can we give the executive director the ability to evaluate this public health order on a rolling basis? Because that way, that would bring into Jan's point of, does it need to be expired 30 days, 60 days, 65 days, 90 days, 120 days? I would actually prefer language that gives John the ability to evaluate over a period of time. And then with a 90-day, we need to vote on this as a board. So if in 60 days John recommends that this should be lifted, then you can come to the board and give us that information.
Madam Chairman?
Yes, Mr. Overton.
Yes, I'd recommend that the board give discretion to your executive director to make that determination based on what's happening on a daily basis on the ground, and be able to evaluate that on a daily basis, because that's really what's important to make sure we have effective public health order that is being able to be enforced correctly for the interest of the public health. So I think you need to give a little bit of discretion to your executive director to determine when the right time is to either rescind or change the order, and then come back to your board again.
Thank you, Mr. Overton. That was my point. I was trying to get more clarity on that. Thank you.
Would it satisfy Sid's point if that language was revised to the order will expire on or before 90 days unless extended by the Board of Health? That gives the director a chance to rescind it if there are circumstances indicate it's not needed or there's an issue with it, but it leaves the board the option of approving it. I'm not sure whether that's what Julie and Jan wanted to be sure was in there or not. I'm very happy to have that authority extended to me, but I wanted to clarify what what the will of the board was in that regard.
For me,
Rosanna, this is
really,
Jennifer.
Go ahead. Go ahead, Jennifer.
Thank you. Just point of thinking about the language, other orders and how they've been from the state and initial orders that we have issued as the Tri-County Health Department. It's, the typical language is amend, extend, or rescind. So it gives the options to be constantly looking at the data, evaluating it, and either extending it, amending it as needed. Should we identify that there's a need to add something or remove something, or rescind it altogether because everything has changed, or perhaps there's a statewide order. There's a lot of things, and that 90 days, we could keep that 90 days in, but that language of amend, extend, rescind gives us those options to do just that. If you would be, thank you, that's going in there, but that would, it's kind of the logistics and details of writing the order.
So would that then take away the 90 days?
It would not.
Okay, I'm trying to think of how to
because
work.
they all have, most of the orders, especially coming from the state, have an end date with that exact language, which it would go for that length of time or a certain date with the ability to amend, extend, or rescind.
Nice that language.
It's good language.
I think that really helps clarify the flexibility.
Okay. Once again, I will read we do have a motion on the floor. We have called for the question and we move, the motion is move to direct, authorize the executive director of Tri-County Health Department, and it just disappeared.
There we go, sorry.
To issue a public health order for face coverings for all 3 counties, i.e. Adams, Arapahoe, and Douglas, with an opt-out clause for any municipality or county in Tri-County Health Department's jurisdiction. Further, this order will expire on or before 90 days from its implementation date. However, it may be amended, extended, or rescinded by the executive director of Tri-County Health Department. Okay. There was a suggestion for a roll call vote. I will start reverse order by Adams County. Mr. Richard Delaney.
Aye.
Ms. Julie Mullica.
Yes.
Myself, Rosanna Reyes, yes. Arapahoe County, Jan Brainerd.
Yes.
Dr. Thomas Faywell.
No.
Dr. Kaya Gallagher.
No.
Douglas County, Ms. Marcia Jarrett.
No.
Ms. Paulette Joswick.
Yes.
And Mr. Zach Nanestad.
No.
Or Nanestad, excuse me. I said it wrong. Nanestad.
No.
Okay. So what is that we have, Paulette? 3,
I said
Renee?
aye.
All right, thank you. Okay, 3, 4.
So we have 5 yeses and 1, 2, 3, 4 noes.
Okay, thank you.
Motion passes.
And the motion passes.
You forgot no from we the people?
Please remove that individual from the call, the meeting, please, Ronnie. Thank you. Okay, with that motion passes. Then we have next on the agenda other items, but we have gone over our time. I want to be respectful for all your time, which I know is very valuable. And I appreciate your patience with this effort to maintain health in our Tri-County area.
And I'm sorry, I need to leave the meeting. It's
Thank you.
Paulette.
All those, I need a motion to end the meeting. All those. Paulette, would you like to make that motion?
Sure, yes, I moved that we end the meeting.
Second.
Thank you. So moved. The meeting is ended. Thank you so much.
To vote on it.
Thank you, Rosanna.
Thank you.